I'm Shania, and today I'd like to talk to you about the antibiotic vancomycin. So let's talk about how's this drug going to work? Well, it is a glycopeptide antibiotic, and so it's going to inhibit cell wall synthesis. Well, how does it do that? Well, it's going to bind to amino acids to prevent the addition of new peptidoglycans. Well, once again, you're probably thinking, oh, this means nothing to me. What does this mean? So let's look at the little drawing here. I like to think about it as we have our bad guy, some bacteria. He's trying to build a wall around himself, keep himself safe, where our hero vancomycin comes in and is like, hey man, you really should stop. And he takes all of his wall building supplies, amino acids, and he's not gonna be doing too good after that. Okay, now that we got that out of the way, let's talk about, what is vancomycin used for? It's most commonly used for methicillin-resistant MRSA infections, or sometimes C. diff infections that cause colitis. Well, if you look at my little drawings over here, to remember these, I like to think about your bacteria as zombies. They're bad. Then we have our good guy, vancomycin. He's going to come rough them up. You know the drill, okay? Well, what's going to happen if you take this? What can you expect? You can expect some ototoxicity or hearing loss. Possibly, it's kind of rare. But the trademark symptom is red person syndrome, which is a red itchy rash on your face, your neck, and your upper torso. You can also expect maybe some hypotension or some renal toxicity. Now, as a nurse, why are all these things important? Why should you know this? Well, you want to make sure that you have a nice, happy, healthy patient. And this drug tends to be toxic to the kidneys. So you want to make sure to monitor their ins and their outs. You want to make sure to monitor the trough levels of this drug. And if there's any red person syndrome that comes about, you want to make sure to infuse it at a slower rate. And you want to really make sure to look for that hearing loss, because that could be a sign something's not right. And if you're giving this to an elderly patient, use with caution, because they could already have pre-existing conditions. And also, before we go, make sure to look for allergic reactions, because it is possible to be allergic to vancomycin.